Happy last day of Nurses Week. So in the spirit of it being the last day of Nurses Week, I thought I would answer one of the most common questions that I run across. And that is, what is an ADN and what is a BSN? And like, what's the difference and which one should I do? So let me tell you, first off, an ADN is an associate's degree in nursing and a BSN is a bachelor's degree in nursing. So as you might guess, based off that, ADN, associate's degree, you're getting an associate's degree. So it's essentially a 2-year degree, and a BSN is essentially giving you a 4-year degree. And before we get into deep, ultimately, both paths lead to you becoming a registered nurse. They're different paths to the same end, essentially. Now we'll talk about the distinctions in a minute, but essentially both are going to put you through a nursing program. You're going to end up with a nursing degree. Both are going to qualify you to sit for boards, meaning you get to sit for the NCLEX exam. Once you're on the other side of that, you are now a licensed registered nurse in both scenarios. ADNs and BSNs, same degree. Not same degree, same license. And for the most part, on the other side, once you're in a clinical setting and working in your job, you aren't going to see much difference between an RN that has an ADN and an RN that has a BSN. Like, for the most part, they're working side by side, doing the exact same job. So from that standpoint, there's very little distinction there. So with the ADN, it's going to be a faster degree to achieve. And so the advantage of that is the sooner you can enter a workforce and get to getting a job, getting paid, making real money. It's going to take a little longer in order to finish your BSN and get on the other side. And so you're a little slower to enter the workforce. If you are kind of cost conscious, then the ADN may be a better route for you, because usually, you usually are going to obtain an ADN from a community college, and usually community college tuition is going to be cheaper than the university tuition where you need to go in order to get your BSN. So usually tuition is cheaper, and the time you're spending paying that tuition is going to be less because you're doing a 2-year degree. Now, usually it's a 2-year degree, but sometimes you can find a program that's like 18 months, a little more accelerated. That's, assuming you've already done your prerequisites in order to even get into the program. Same for a BSN. You already have to have all your prerequisites completed in order to get into the BSN program. So sometimes it's really more like a 3-year nursing curriculum program, because you already did a year's worth of undergraduate curriculum to get to get in. So it's going to be 2 years, and then you can sit for boards. Now, if you have future aspirations to be, move up the ladder in nursing, you may eventually, and are probably going to need a BSN. So still making note of that financial advantage. Generally, hospitals will pay for you to go back to achieve your BSN. So they'll pay your tuition for the expensive part that's over at the university when you're already working for them. So you probably had it cheaper coming out to get your ADN. And then when you're working, you can usually get tuition covered from your employer, because there's usually bridge programs, RN to BSN programs, and the hospitals will pay for that. Usually. Not probably exclusively, but I can't think of, I don't know about all the programs across the country, but standard to say. And if that is your goal, pick a place that will pay for it so that you can get it covered. So with these advantages of an ADN financially, why would you pick a BSN? So if you have aspirations to do more, like you want to move up in, be a nurse manager, nursing administration, want to go on to be a nurse practitioner, DMP, PhD, anything like that, then you're going to need a BSN, probably pretty exclusively. There may be certain circumstances in certain geographical locations that will move up ADNs within a hospital, but for the most part, usually, at least anything that I've been familiar with, you have to have your BSN in order to do so. And like I said, sometimes they'll pay you to do it. They'll cover it, especially if like they want you to move up. Like, so they'll encourage you to get your BSN, and we'll cover it in order for you to move up. Now, if you've already done your BSN, you don't have to go back to school. It's already done. So now on that side, you're quicker to move up because you don't have to go back to school in order to get that BSN for future advancement. In terms of hireability, I would say that the BSN has the edge. All considered, probably the BSN is going to beat out the ADN if there's no other distinction between candidates. Some hospitals just generally prefer a BSN candidate. Same goes for like nurse residency programs or certain specialties. Like if you're trying to get into a more competitive specialty, these scenarios, it's to your advantage to be having a BSN because generally that's going to be viewed more favorably. Some residencies will accept ADNs, but require you to be getting your BSN. So, you still have to get there anyway. So ultimately they're both leading you to the same direction. You're going to have a little more, once you're ready to move up the ladder, you already have, the BSN, if that's your goal. If it's not your goal, then maybe the ADN is the right answer for you. Or maybe it's your lifestyle that getting to the local community college is easier than you having to like commute maybe farther away for, the university to get your BSN, that kind of thing. These are all factors that you have to consider when trying to pick a path. So in general, that's a nutshell of what the differences are. One is not necessarily better than another. They will still let you become a licensed registered nurse. It's just a different path and sort of what your goals are in your future. All right. Happy last day of Nurses Week, and I'll see you later this week.